Howdy, Michael Davies here with the pharmaceutical company. We will talk a little bit about the use and dosage of the drug and some of the side effects this medication. Azithromycin is an antibiotic that fights bacteria. Azithromycin is used to treat many different types of infections caused by bacteria, such as respiratory infections, skin infections, ear infections, eye infections, and sexually transmitted diseases. Azithromycin may also be used for purposes not listed in this medication guide. Important information. You should not use azithromycin if you have ever had jaundice or liver problems when you have previously taken this medicine. You should not use azithromycin if you are allergic to it, or if you have ever had jaundice or liver problems caused by taking azithromycin. Or you are allergic to similar drugs such as clarithromycin, erythromycin, or telithromycin. To make sure azithromycin is safe for you, tell your doctor if you have ever had liver disease, kidney disease, myasthenia gravis, a heart rhythm disorder, low levels of potassium in your blood, or long QT syndrome in you or a family member. This medicine is not expected to harm an unborn baby. Tell your doctor if you are pregnant or plan to become pregnant. It is not known whether azithromycin passes into breast milk or if it could harm a nursing baby. Tell your doctor if you are breastfeeding a baby. You may take most forms of azithromycin with or without food. Take Zmax extended release liquid, oral suspension, on an empty stomach, at least 1 hour before or 2 hours after a meal. To use the oral suspension single-dose packet, open the packet and pour the medicine into 2 ounces of water. Stir this mixture and drink all of it right away. Do not save for later use. To make sure you get the entire dose, add 2 more ounces of water to the same glass, swirl gently and drink right away. Throw away any mixed Zmax oral suspension, extended release formulation, that has not been used within 12 hours. Throw away any immediate release suspension that has not been used within 10 days. Shake the oral suspension, liquid, well just before you measure a dose. Measure liquid medicine with the dosing syringe provided, or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. Use this medicine for the full prescribed length of time. Your symptoms may improve before the infection is completely cleared. Skipping doses may also increase your risk of further infection that is resistant to antibiotics. Azithromycin will not treat a viral infection such as the flu or a common cold. Store at room temperature away from moisture and heat. Take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make up the missed dose. Do not take antacids that contain aluminum or magnesium within 2 hours before or after you take azithromycin. This includes Acid-Gon, Aldroxycon, Alternigal, D-Gel, Gaviscon, Galucil, Genadin, Malox, Maldroxil, Milk of Magnesia, Mintox, Mylogen, Mylanta, Pepcid Complete, Relades, Rulox, and others. These antacids can make azithromycin less effective when taken at the same time. Antibiotic medicines can cause diarrhea, which may be a sign of a new infection. If you have diarrhea that is watery or bloody, call your doctor. Do not use anti-diarrhea medicine unless your doctor tells you to. Avoid exposure to sunlight or tanning beds. Azithromycin can make you sunburn more easily. Wear protective clothing and use sunscreen when you are outdoors. Avoid other drugs that can cause QT prolongation or irregular heart rhythm. Azithromycin side effects. Get emergency medical help if you have signs of an allergic reaction to azithromycin, hives, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning in your eyes, skin pain, red or purple skin rash that spreads and causes blistering and peeling. Symptoms may include skin rash, fever, swollen glands, flu-like symptoms, muscle aches, severe weakness, unusual bruising, or yellowing of your skin or eyes. This reaction may occur several weeks after you began using azithromycin. Call your doctor at once if you have severe stomach pain, diarrhea that is watery or bloody, fast or pounding heartbeats, fluttering in your chest, shortness of breath, and sudden dizziness, like you might pass out. Or liver problems, nausea, upper stomach pain, itching, tired feeling, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. Call your doctor right away if a baby taking azithromycin becomes irritable or vomits while eating or nursing. Older adults may be more likely to have side effects on heart rhythm, including a life-threatening fast heart rate. Common azithromycin side effects may include diarrhea, nausea, vomiting, stomach pain, or headache. Usual adult dose for Legionella pneumonia. Community-acquired pneumonia, oral immediate release, 500 mg orally as a single dose on day 1, followed by 250 mg orally once a day on days 2 to 5. Extended release, 2 grams orally once as a single dose. Parenteral, 500 mg for once a day as a single dose for at least 2 days, followed by 500 mg, immediate release formulation, orally to complete a 7 to 10 day course of therapy. Formulations should be taken on an empty stomach. Azithromycin kills bacteria by inhibiting bacterial protein synthesis. Azithromycin is used to treat infections caused by susceptible bacteria such as Mycobacterium avium, M. intracellular, and Chlamydia trachomatis. Azithromycin belongs to the class of medicines known as macrolide antibiotics. Upsides: used to treat mild to moderate infections caused by susceptible bacteria occurring on the skin, in the lungs, in the ears, and some infections that have been sexually transmitted. Used specifically for the treatment and prevention of Mycobacterium avium complex, a type of respiratory infection, in people with advanced HIV. May be used in addition to other antibiotics. Active against a wide range of microorganisms and shows good penetration into human tissue. Some bacteria may be resistant, not killed by azithromycin. May be better tolerated and have more effective tissue penetration than other similar antibiotics such as erythromycin. May be used to treat bacterial infections in people intolerant of penicillins. Can be dosed once daily, which improves adherence. Available as a tablet or capsule, in an extended release form, as a powder for reconstitution, and in an injectable form. Downsides: if you are between the ages of 18 and 60, take no other medication or have no other medical conditions, side effects you are more likely to experience include nausea, diarrhea, vomiting, abdominal pain, dyspepsia, flatulence, fatigue, headache are some of the more common side effects. Liver damage and may affect liver function, sometimes fatally. Must be discontinued if any signs of liver dysfunction occur. May cause changes in the way the heart beats, resulting in the development of cardiac arrhythmias. The risk is greater in people with a history of QT prolongation, on other drugs known to prolong the QT interval, with low levels of potassium or magnesium in their blood, and in those receiving antiarrhythmic agents such as sotalol, amiodarone, and procainamide. Severe diarrhea associated with Clostridium difficile is a potential side effect of almost all antibacterial agents, including azithromycin. May cause severe skin reactions and photosensitivity, increased sensitivity to sunlight. Discontinue azithromycin and seek urgent medical advice should a rash develop. Has also been associated with severe allergic reactions. May interact with some other medications including warfarin and nelfinavir. Dosage may need decreasing in those with renal disease and may not be suitable for people with myasthenia gravis. Response and effectiveness: it takes between 2.5 to just over 3 hours for peak concentrations of azithromycin to be reached. A loading dose, a higher than normal starting dose, may be used to reach steady concentrations sooner. Can be dosed once daily. May take several days before symptoms of infection start to abate. Always finish the course as prescribed. That's all for today. Subscribe to the Pharmacological channel and stay with us. Good luck.